Hello everyone, welcome to my channel where you will get simplified, useful and short medical notes. So let's get started with our today's obstetrics and gynecology topic.
Introduction. Pain in labor results from a combination of uterine contractions and cervical dilatation. Methods of pain relief. Pharmacological, non-pharmacological, psychoprophylaxis. 1. Pharmacological methods. Pharmacological methods A. Sedatives and analgesics. Commonly used sedatives and analgesics include 1. Pethidine, 50 to 100 milligrams IM. 2. Fentanyl, 50 to 100 micrograms IV. 3. Morphine, 10 milligrams IM. 4. Meperidine, 5 to 25 milligrams IV or IM. B. Inhalational agents. Commonly used inhalational agents during labor are Entonox, halothane, methoxyflurane. C. Anesthesia. 1. Regional anesthesia. It is given to block the transmission of painful stimuli from the uterus, cervix, vagina, and perineum to the thalamic pain center in the brain. It may be administered once or continuously. 2. Paracervical block. It is given transvaginally near the outer rim of the cervix. This block relieves pain caused by cervical dilatation. Side effects: maternal, systemic toxic reaction, hematoma formation, fetal, bradycardia, acidosis, and even death. 3. Pudendal block. In this method, the injection is given around the pudendal nerve. It is administered prior to episiotomy, suturing, or forceps delivery. Side effect: vulval hematoma. Number 4. Epidural analgesia. When complete relief of pain is required throughout labor, epidural analgesia is the safest and simplest method. A lumbar puncture between L2 and L3 is made using a pudendal needle. Bupivacaine 0.5% is injected. For complete analgesia, a block from T10 to T5 is needed. Nursing responsibilities: check blood pressure, pulse, and fetal heart rate every 15 minutes. Side effects: hypotension, pain at the insertion site, back pain, post-spinal headache, nerve injury. 5. Spinal anesthesia. The drug is injected into the subarachnoid space at the L3-L4 lumbar interspace. Commonly used drugs are bupivacaine 5 to 10 milligrams, lignocaine 25 to 50 milligrams. Nursing responsibilities: record blood pressure and respiratory rate every 3 minutes for the first 10 minutes and then every 5 minutes thereafter. Administer oxygen in case of respiratory depression or hypotension. 6. Perineal infiltration. This is done 2 to 5 minutes before performing an episiotomy. About 10 ml of 1% lignocaine is infiltrated in a fan-wise manner at the episiotomy site. Aspiration to exclude blood is mandatory before injecting. 2. Non-pharmacological methods. 1. Transcutaneous electrical nerve stimulation, or TENS. Pain is relieved by electrical nerve stimulation. Electrodes are placed at the levels of T10 to L1 and S2 to S4. The current strength can be adjusted according to the woman's pain. It works by inhibiting pain transmitters at the interneuron level. Disadvantages: allergy to electrode pads, risk of interference with fetal monitoring, 2. Acupuncture. Pressure is applied at specific points on the body through the insertion of fine needles. It produces sedation and analgesia by releasing beta endorphins, natural painkillers and stress relievers. 3. Acupressure. Massage is applied to specific pressure points. This also stimulates the release of endorphins, helping reduce pain. 4. Meditation and yoga. Meditation, breathing exercises, and yoga help relax the mother, reduce anxiety, and distract her from pain.
3. Psychoprophylaxis. Psychoprophylaxis is a psychological method of antenatal preparation designed to prevent or at least minimize pain and difficulty during labor. Relaxation techniques and proper motivation help reduce fear and anxiety. Not every case of labor requires analgesia. In many women, a sympathetic explanation, reassurance, and guidance are sufficient to help them cope with labor pain. Thank you. For more such simplified, useful, and short medical notes,